Welcome to Who's Hiring Now, a new video series hosted by GSEP Career Services. I'm Franny Demerjian, and my colleague Jacqueline Lammers will host today's session. The Who's Hiring Now video series is designed to provide our GSEP graduates with current employment opportunities that they can consider as they embark on their job search. And today we are thrilled to have Kelsey Schaefer and Jennifer Silverman from Evolve Treatment Centers. Let's jump right in.
Awesome. So if you could please introduce yourself, what roles you are hiring for, and describe your organization.
Sure. I'll start off, Kelsey, and then you can fill in the blanks. So specifically for students coming, out of their master's program, we have two associate therapist program positions available. One would be for our North Valley areas, which cover Ojai, Calabasas, and Agora Hills. And the other one is for our San Diego locations. And we have 3 locations there, 2 in Encinitas and 1 in La Mesa. So those are the primary roles, that would probably be what the students are most interested in. They're basically training positions that allow the candidate to learn about our systems and processes, and eventually, the career path is to become a primary therapist. And that can happen very quickly. So it's a great opportunity to get in, learn about the company, start getting clients, and really hit the ground running.
Yeah, I would say the associate therapist position is a really great place to start, especially coming right out of graduate school, because like Jennifer said, it very likely will turn into a primary therapist position where you do have a full caseload. And associate therapists actually start out with much smaller caseloads, usually with just one client. And oftentimes they're getting a lot of specific training around family sessions and even how to navigate the individual sessions before slowly taking on more.
And they'd be working, just to clarify a little bit about Evolve, working in our treatment centers, which are 24/7. We have up to 6 clients at a time, and it's, working with teens, specifically 12 to 17, who have, Kelsey can probably speak more therapeutically about it, but basically they might have dual diagnosis, have been suicidal, have come to us, referred from hospitals, and we would go through a number of different treatment programs with them while they're with us.
Yeah, our clientele is pretty acute. Like Jennifer said, our adolescents are often admitting to our programs right after psychiatric hospitalization. And these are kids that are struggling with, significant mental health disorders and or addiction disorders as well. So we'll treat both simultaneously as they occur, hence us being a dual diagnosis program. And what's really great about the associate therapist role in any sort of clinical opportunity, like a new or graduate student, or someone who's just finished graduate school would be interested in, is you're learning a lot of these evidence-based practices like CBT, DBT, motivational interviewing. You're learning how to incorporate these types of modalities into your therapeutic work.
Thank you. And the next question, what professional development opportunities do you provide for new and existing employees?
It's a great question. I can answer this. I feel like I'm the poster child for a lot of professional development opportunity at Evolve. I'm, Kelsey Schaefer, as I was introduced earlier, and I'm a licensed marriage and family therapist. And, as a, newer associate, out of graduate school, you've just registered with the BBS and you have your number. Say you start as an associate therapist. Like I had mentioned, there is a pretty quick growth track into a primary therapist role. many of our primary therapists are associates, they're AMFTs or even associate clinical social workers. And oftentimes many of our primary therapists will stay in their roles for quite some time, even once becoming licensed. You get your hours quite quickly as an associate, which is nice. You have, group supervision and individual supervision weekly, in addition to all of those direct service contact hours you're providing with the clients on your caseload. So you'll accrue hours quickly and work towards licensure quickly, which is wonderful, in addition to getting this really rich, intense clinical training experience. And something that's been really wonderful too is several of our program directors that we have started as primary therapists. So they've moved into program director positions once becoming licensed and being able to clinically supervise. And I can speak for myself. This is what my professional development track looked like at Evolve. I've been with the company for 6.5 years, and I started out as a therapist, and then I had moved into a program director position once becoming licensed and being able to supervise. And there are even clinical positions beyond that. So if the treatment world, working in residential treatment, is something that's interesting to you, or even, outpatient treatment, because we do provide partial hospitalization and intensive outpatient services as well. So if that treatment center realm is something that's really interesting to a new graduate of Pepperdine, there is quite a growth track for, clinical development within someone's career, from a therapist role to a director role, and really beyond, like myself being in a clinical leadership role now.
And I would add to, our CEO also went through that track, so there, everyone I believe that we have pretty much in our executive team came from, working their way up, within the system. There's few people that came from the outside, but the majority came from internal. And we now have about 11 treatment centers. Our, goal is really to open additional treatment centers each year. With COVID, that got slowed down a bit, but we have 6 in the LA area. We have 3 down in San Diego right now, and we have 3 in the East Bay, and then 1 in Sacramento. And that's just the treatment centers. And then we have outpatient as well. Not as many, but there's definitely opportunities to grow within the company, and the company itself is trying to grow additional treatment centers and offer, the services to more clients.
Yeah.
Wonderful. Thank you for that. We'll move on to the next question. How is work structured to provide flexibility and work-life balance?
I can start to answer this question as well. So I mentioned previously, I have done the therapist role at Evolve, so I can speak to what that looks like. You're a full-time employee, of course, you work Monday through Friday, but it isn't like a rigid, like you're clocking in at 9, you're clocking out at 5. You can be flexible with your hours, but of course within reason. So I know some days I would skew a little earlier. Maybe I'd start my day at 9. Maybe other days I'd start my day closer to 10 or 10:30. It would sometimes depend too on where my clients' families were from. Because at Evolve, we're working with kids all across the US. So when you're scheduling family sessions, and maybe those are being conducted over telehealth, you sometimes do factor in those time differences. So flexibility with hours is nice in that regard. Sometimes it almost felt like I was scheduling my clients' individual and family sessions almost like I would in my own practice, in a way. Our therapists also, they get a work from home day once per week, which is really nice. I know that day is so needed sometimes for our therapists, especially our therapists that work in residential, because, our clients, we see them for sessions, but you're also seeing them after they get back from an outing. You're seeing them when they eat their meals. You're seeing them when they're, engaging in recreation time or school time with their other peers and other staff members. So the boundaries there sometimes can, you've got to really maintain those tight boundaries with your clients, because it could be so easy to just kind of wiggle yourself into their day. So having that once weekly work from home day to catch up on documentation, focus, make any calls, that are necessary or pertinent to your client's treatment and care, that is super helpful. And Jen, you can speak to PTO and I think what like benefits look like in that regard as well, just in terms of our floating holiday that we offer, holidays that the company acknowledges, and so on and so forth.
Yeah, usually employees start out as an associate with our PTO policy, which is starting at 10 days per year, but of course they have to, accrue it first. When they become a therapist, they actually move to our 15 days per year accrual. And then we have additional, I believe we're up to about 10 holidays per year, as well as occasionally we have a floating holiday, which we use really as a mental health day. That's kind of the intention of that. And then of course, sick time. And, like Kelsey was saying, we're constantly evaluating the positions. It is a treatment center. So, the majority of the time is on site, but there's flexibility in time, the work from home day. As people move up in their career, there's a little bit even more flexibility regarding that. A lot of the people in the company too, we have folks who have gone from being a primary therapist to working at our admissions staff. And then most of those people are remote. So there are opportunities there also in our utilization review department where they work from home. We do have a small corporate office in El Segundo, but there's also a lot of folks, who work there who are, maybe half-time in the office. So a lot of this started with the pandemic and it's just continued because it makes sense for our positions.
Thank you, Jennifer. And the fourth question, what is something unique about Evolve that you would want your prospective applicants or candidates to know?
Yeah, I mean, I can, remember when I was in graduate school. I'm not an alum of Pepperdine. I went to Cal State Northridge, but I remember just not being aware of exactly what is out there. What can I like sink my teeth into once I, graduate and I get my registered associate's number. And knowing that there could be opportunity for you at Evolve is really special, because Evolve is going to give you some really awesome intensive clinical training and mentorship that I know for me, I can say I don't really think I would have been able to get anywhere else. Everything from learning how to really incorporate CBT into my therapeutic work, or DBT. I was sent to Dr. Marsha Linehan's foundational training through behavior tech as a therapist. And that was, because I was working at our DBT comprehensive program at the time, but it was just such a rich experience for me to get such great training with how to use such tried and true evidence-based practices, specifically for teens that are really high risk in displaying these really big behaviors. And I know when I was just out of graduate school, I was very eager to just roll up my sleeves and dive into a challenging type of population and challenging type of work. And I'm forever grateful for that. And I feel like working in a treatment center like ours at Evolve specifically, you are going to get equipped with so much clinical knowledge and skill that you'll be able to carry on with you no matter what you decide to do in your career years down the road. If you want to go work in a hospital setting, or say you want to, work in, quality assurance, or you want to work in private practice, or you want to work in a school-based setting, all of this really intensive, rich clinical work that you do with our teens and their families, and all this training that you get, using, again, those evidence-based tools in psychotherapy are just, it's super invaluable. And I know I can speak for myself with that, because I feel my time at Evolve has really set my career up for success no matter what I do, because I've learned really so much.
And I'll add, one of the things I was impressed of, since, I'm coming from the HR side as an HR director, was that the facilities are so nice, because they're private homes in a community, wouldn't even know that it's a treatment center. And, part of our program is that we have a pool at every site. We have a gym. You know, it's a beautiful home. We have a chef on site that feeds not just the staff, but obviously the clients, but the staff as well. And, you know, it's a very structured program. They get to go outside, you know, to do special rec activities like surfing or equine as well. So it's a very comprehensive program, very structured, and, you know, a pleasant environment as well to work in, instead of, you know, some hospitals that might be out there that, you know, have seen better days.
Yes.
So, you know, that's one of the things that was impressive to me, you know, so parents want to send their kids here because of, you know, not just the quality of, you know, treatment that they receive, but because, you know, they feel comfortable having their kids stay with us for 30 to 45 days because of the environment as well.
Yeah. Yeah, it is very, very home-like, and it's not sterile feeling at all. I remember feeling very grateful for that when I started as a therapist with my office. Like, my office was once like a guest bedroom in this luxury home, and I had my own bathroom, and yeah, it's definitely a much different feel than your typical clinic or hospital type setting.
Great. That sounds great. Thank you for sharing that. We'll move on quickly to our last question. What is it about Pepperdine graduates that make them desirable to hire?
Yeah, I mean, I don't think we had mentioned this yet, but Jennifer spoke to this earlier. Our CEO has been on quite the growth track, like, you know, myself, because she's been with Evolve since day one, and she actually happens to be an alum of Pepperdine. And I would say, you know, of course, not just because Michelle is such a great clinician, she's really led the company into such a great and positive direction, but, you know, Pepperdine students, like, we're very aware of the knowledge and the skill that graduate students from Pepperdine really possess upon, you know, completing their program. And we've had several even current students from Pepperdine even be in some of our lesser clinical roles. Like, some of our employees have even been in our counselor positions, residential counselors, and you don't need a license or to be registered with the BBS to take on that role. But there's so much value, at least for us, knowing that we're getting employees like potentially from, you know, schools like Pepperdine, where we know that they're getting a really rich academic experience. And there's also so much interest, of course, that we know folks who are coming out of graduate school have, you know, of course, in psychotherapy and in, you know, this realm of working in, you know, crisis residential treatment. And so I think having more folks come from Pepperdine, where we've already had great experience, you know, of course, like with our CEO and others who have joined our organization, I think it's a good match, I know, for us as an employer and for, you know, a candidate like coming from Pepperdine, because we're very like-minded in terms of I think the goals and the clinical skills that we're eager to like set forth for our employees.
And we'd love also, you know, to find people from, you know, a local school such as Pepperdine for our programs that are, you know, not too far from that area. You know, because a lot of folks, once they go to grad school, they're in that area, they want to stay in that area and might have trouble finding, you know, positions in those locations. So, you know, we're glad that we have some, you know, that are close to the school as well.
Yeah. Yeah, because so many of our residential programs are not far from Pepperdine at all.
Well, thank you so much, Kelsey and Jennifer. This concludes our Who's Hiring Now episode. And thank you for watching. And remember that GSEP Career Services is here to support you with your career journey.